International Stem Cell Corporation, the parent company of Lifeline Skin Care, works with some of the best known and respected in vitro fertilization (IVF) clinics in the United States, and only with these clinics. The process in this is closely regulated by the Food and Drug Administration (FDA) for the benefit of all concerned: the donor, the IVF clinic, the therapeutic research organizations, and eventual recipients of those stem cells. The unfertilized human eggs are made available because the donors are interested in advancing innovations in regenerative medicine. They understand that the non-embryonic, parthenogenetic stem cells will be used to study, and possibly one day treat, regenerative diseases or injuries such as Parkinson's disease, congenital liver disease, diabetes, and skin aging.
Donor selection and screening. Every donor is subjected to a battery of psychological and medical tests to determine suitability. The procedures and selection criteria meet the requirements of the U.S. Food and Drug Administration (FDA), Department of Health and Human Services, CFR Title 21, Part 1271, to screen for genetic and communicable diseases. Determination is based on 1. The donor must be free of infection and communicable diseases, including but not limited to HIV, hepatitis B and C. 2. The donor must be free of risk factors, including non-medical drug use, use of tobacco or drugs for at least 2 years, previous sexual relationships with anyone known or believed to have an infectious or communicable disease, incarceration, recent tattooing, ear piercing or body piercing, recent smallpox vaccination, miscarriage within the prior 3 months, unusual skin conditions such as inflammation or discoloration, recipients of blood transfusions while or resident or visitor in certain international countries, abnormal gynecological examination, and literally hundreds of other criteria.
3. The donor must be between 21 to 29 years old. Although 18 is the legal age of consent for tissue donation, it is ISCO's belief that the rigors of hormone stimulation and oocyte donation require greater maturity and understanding. 4. Successful completion of medical history, physical examination, and lifestyle interviews that are completed by the IVF. For example, individuals with a body mass index less than 20 or greater than 30 and those with psychological complications are deemed not suitable for the egg donation process.
5. All subjects must pass a test that establishes that they understand and accept the risks associated with hormone stimulation. Finally, the donor must sign a formal consent that has been approved by an institutional review board that is authorized by the Federal Department of Health and Human Services for anyone involved in medical research. All donors are required to remain anonymous by law.